Hi friends, I am Dr. Richa Malhan, a gynecologist and a fellow mother. On this page, Modern Janani, we talk everything about women health, motherhood, pregnancy and parenting. Today we are going to talk about how much caffeine is actually allowed in pregnancy. You might have come to this channel because you must have heard from somewhere that coffee or tea is not allowed during pregnancy, but it's not true. Coffee and tea can be had in pregnancy but in limited quantities. The maximum allowed quantity of caffeine that you can take in your pregnancy is 200 milligrams. So one regular cup of cappuccino has around 100 milligrams of coffee. So you can have 2 small regular cups of coffee every day. If you're fond of espresso, then it has 76 milligrams of caffeine. So you can have about 2 cups of espresso also per day. Well, if you thought that decaf does not have any caffeine at all and you can have as much, then I'm sorry to say, but it's not true. Decaf has around 6 milligrams of caffeine, which is very less of course. So you can have quite some amount of decaf, but make sure that the amount is still lesser than 200 milligrams per day. Well, if you were fond of Coke, then Coke also does have some amount of caffeine. It is about 34 milligrams of caffeine in 1 glass of Coke. So you can go ahead and have Coke if you please. A lot of pregnant women also have recurrent headache that is sometimes relieved by Coke. A few of my patients have come to me saying that just a glass of Coke and their headache goes, which otherwise bothers them a lot. So you can go ahead and have that 1 glass of Coke. It will not do you much harm, though it's not a very healthy thing to take. But in case you feel quite dependent on it, then 1 or 2 glasses will not do you much harm. So caffeine is not good for you because it crosses the placenta and it goes to the baby. So when you're having caffeine, that reaches the baby and hinders with the development of the baby. So make sure that you always have caffeine within the prescribed limits of 200 milligram of caffeine or less. Then probably the baby will not have any harm and you can be in the safe zone. Otherwise, please try and change your habits. Pregnancy is very precious and you know it. So let's just take care of ourselves during these few months. This caffeine does not go into the breast milk. So once you're done with your delivery, and even if you're feeding the baby, breastfeeding the baby, it will not go towards your baby. It will only remain within your system. So it's just this 9-month stretch that you have to kind of limit your caffeine intake. Later on, it's going to be fine. Also, caffeine causes a little extra nausea and vomiting in certain women. So even if it's not doing any harm to the baby, if you feel too nauseated, then caffeine is to blame in case you're having it. So in that case, again, you have to reduce the quantity and see, and if that also doesn't help, then you'll have to stop the caffeine intake entirely. It is better to stop it than be dependent on anti-vomiting drugs. I hope this video was useful. For more such videos and regarding busting many myths about pregnancy that are going around, you can always come back to my channel. Please like, share and subscribe. Bye.